Welcome to today's presentation, Heart Health for South Asians, presented by Meghana Bachu, family nurse practitioner with Washington Health Medical Group. Meghana is a compassionate and bilingual family nurse practitioner with a strong background in providing comprehensive care to adults 18 years and older. Meghana's clinical experience spans a variety of healthcare settings, including family medicine, community health, and cardiac care. As a family nurse practitioner at Washington Health Medical Group, she provides preventative care, wellness visits, and chronic disease management for adult patients. Her approach to patient care is holistic, treating the person as a whole rather than focusing solely on their medical condition. She emphasizes mental health, wellness practices, and access to community resources to empower her patients in their healthcare journeys. Outside of her professional life, she enjoys trying new restaurants, traveling, and exploring different parts of the world. Please welcome Meghana Bachu.
Hi, I'm Meghana Bachu. I go by Maggie. I'm a family nurse practitioner with Washington Health, and today I'll be discussing South Asian heart health. I want to start out with a background about myself. I have a bachelor's in nursing, and after I wrote my exams, I became a registered nurse. I worked in cardiac care in the hospital, which is the heart unit, for a few years. Then I went on to get my doctorate in nursing practice. After passing the board exams, I completed a family nurse practitioner residency, and I've been working as a family nurse practitioner for a few years, most recently here at Washington Health. Starting off with talking about South Asian heart health, we want to define what South Asians are. This includes people from India, Pakistan, Bangladesh, Sri Lanka, Nepal, Bhutan, and Maldives. This includes the South Asian diaspora as well. According to the Global Burden of Disease study in 2019, 58% of cardiovascular disease-related deaths were in Asia. In the U.S. itself, between 2003 and 2017, Asian Indians had the highest mortality rate for coronary artery disease, which is disease of the heart's blood vessels, and they're the only group for which the rate is increasing. So I believe it's really important to talk about South Asian heart health due to these facts. The Congresswoman Pramila Jayapal from Washington State has tried to pass the South Asian Heart Health Awareness and Research Act in 2022 and 2023. It is currently still in review. It would provide federal funding for educational materials regarding South Asian heart health in the community and amongst healthcare workers as well to help educate the public. Today, I'd like to stick to a few subjects when we're talking about South Asian heart health. This includes nutrition, staying active, sleep, and mental health. Starting off with nutrition. As part of nutrition, I'd like to discuss the benefits and challenges of our diet. First, one of the benefits of our diet is that we use a variety of foods. This includes probiotics, vegetables, different various sources of proteins. We use spices throughout our foods, which are great for antioxidants and anti-inflammatories in our diet. We love to cook our meals at home, so we know where our ingredients are coming from, and we reduce the chance of artificially processed foods in our diet. And lastly, we eat a balanced diet. Our meals consist of a grain, a probiotic, veggies, protein. So we have quite a balanced diet. Moving on to the challenges of our diet. We do prefer to have an increased salt intake in our diet, which can increase blood pressure, which is not great for our cardiovascular health. When we're eating out, we tend to have fatty fried foods like pakoras, biryani, which has red meat in it, and butter, lots of butter and ghee. And lastly, I wanted to highlight our meal times because a lot of us tend to eat dinner quite late, quite close to bedtime, which is not great for our digestion. Moving on, I wanted to introduce a few healthy alternatives for our diet. The left side will focus on common foods that we eat, and the right side will focus on healthy substitutions. I'll highlight a few of them on this slide. The first one is white rice. It's best to reduce our white rice intake, or if you're not able to fully reduce, it's good to have a mix of white rice with quinoa, brown rice, or a mix of those grains. Another common substitute that is good for our health is substituting all-purpose flour, or we like to call it maida, with whole wheat, almond, oat, or chickpea flour. Usually I tend to say any food that is white in color may not be the best for us because it is more processed. And lastly, I wanted to highlight something I've seen very common in my patients, which is a regular drinking of chai or coffee and the use of full-fat milk and sugar in these drinks. For the full-fat milk, an alternative would be switching to 2% milk or alternatives such as oat, soy, or almond milk. And for the sugar in the chai, reducing the white sugar intake, adding spices so we don't need as much white sugar, or alternatives which include honey, jaggery, maple, or date syrup. There are a few others listed here that you may take some time to read as well. Overall, I believe that we should be eating everything in moderation for a healthy, balanced diet. Moving on to the next topic, I'd like to discuss staying active, which promotes good heart health. Some things that we do well in our culture is having post-meal walks. We're very good at taking walks after dinner, which is great to reduce blood sugar spikes. When we wake up during the day, we do morning stretches and yoga, which is great for our bone health and our musculoskeletal health. We're really good at taking care of household tasks, doing that physical labor to increase our heart rate. And another more fun activity of taking care of the household is gardening. Things that we can improve on with staying active is having a regular regimen. So not just having those post-meal walks after eating full, heavy dinners, but to make it more of a regular thing. Another thing we should be able to do is increase our heart rate when we stay active, taking care of our chronic conditions and encouraging our support system to have healthy cardiovascular health. I'll touch on the last two a bit more in the coming slides. With regards to heart health, I have a few recommendations on this slide. The first one is the American Heart Association recommends 150 minutes of moderate intensity exercise per week. What does moderate intensity look like? Well, it could be a brisk walk, it could be a dance class, or it could be playing tennis. It's really hard to conceptualize what 150 minutes per week means, so it's best to break it down into 30-minute intervals 5 days a week with 2 days of rest. This should more look like a goal for you rather than a starting point. Two other things I'd like to highlight are BMI and central adiposity. It's found through research that the cutoff for normal weight, or BMI, is actually 23 kilograms per meter squared rather than 25 milligrams per meter squared in South Asians. This is due to the fact that we have an increased chance for central adiposity. Central adiposity is an increase in waist circumference over 90 centimeters in males and greater than 80 centimeters in females. Central adiposity leads to a twofold risk in diabetes, hypertension, and atherosclerotic cardiovascular disease, which is a fancy umbrella term for things like heart attacks, strokes, and etc. This is a chart for moderate intensity exercise to see what your target heart rate should be. For moderate intensity, the heart rate zone should be between 50 and 75%. And you can go ahead and take a look in more detail what those numbers look like for you to use as a goal for staying active. Two things I had mentioned beforehand for staying active. The first one is taking care of chronic conditions. So it's really important to take care of musculoskeletal pain. Make sure you talk with your primary care provider so you have a plan and that this is not impeding you from staying active. It's important to control your hypertension, your diabetes, and your asthma, especially with the asthma, with exercise-induced asthma. It's important that you take your inhaler before activity. The last thing I wanted to discuss is a good support system. This makes staying active less of a challenge and more of an activity. It promotes a chance to bond, it encourages success, and it provides a healthier community overall. The third topic I'd like to discuss today is sleep and its relation to heart health. I'd like to start off by discussing sleep hygiene. It's really important to have a regular sleep schedule. This includes sleeping 7 to 9 hours each night of uninterrupted sleep. It's really important to have a relaxing bedtime routine. This includes reading a book, taking a warm bath, And also very important in today's modern day is to have no electronics at the bedside. Some other things I'd like to highlight is not eating within 3 hours of bedtime because it can not aid in digestion and also not allow you to have good sleep, especially if you have a full stomach. It's important not to have alcohol in the evening because it can reduce sleep quality. It's important not to exercise within 2 hours of bedtime because of the adrenaline rush that can interrupt falling asleep. And lastly, if you are going to take a nap in the day, it should be earlier in the day and be 30 minutes or less. A big topic I like to highlight in terms of sleep and cardiovascular health is sleep apnea. What is sleep apnea? It's repeated lapses in breathing, causing interrupted sleep and preventing adequate oxygenation of the body. Symptoms include daytime sleepiness, snoring, gasping for air, and interrupted breathing during sleep. Risk factors are higher blood pressure, male gender, age greater than 50 years, BMI of greater than 35 kilograms per meter squared, and a neck circumference greater than 40 centimeters. So if you think you have these symptoms or risk factors, it's important to touch base with your primary care provider so they can refer you to sleep medicine, where they'll do a sleep study and assess how well you're sleeping, and possibly prescribe a CPAP machine, which promotes good breathing during sleep. This is really important because controlled sleep apnea is known to reduce blood pressure, in turn reduce weight and BMI, allow you to stay active better, and increase energy overall. This is actually some things that I've seen in patients after they have been assessed for sleep apnea and are given a prescription for a CPAP. I've seen these good changes in their lives. Lastly, I wanted to discuss mental health, which is a very important topic in South Asian population, and it's something we don't discuss enough because there is a stigma around it, and I'm trying to break that stigma by talking about it. So poor mental health can lead to poor heart health. You might ask, how is that? Things like depression, anxiety, increased stress, and post-traumatic stress disorder can lead to increased heart rate, increased blood pressure, elevated cortisol, which is our stress hormone, and reduced blood flow to the heart. It's not necessary that you should need to be diagnosed with any of these things, but as we go through life, we have episodes of life where we have increased symptoms of anxiety and depression that can affect our mental health and in turn affect our cardiac health. So what does this look like in our daily life? It leads to less motivation to stay active and eat healthy. It can lead to things like not taking medications regularly, as well as unhealthy habits such as chronic smoking and drinking. Now we ask ourselves, how can we manage our mental health? Most importantly, and first of all, is to recognize our symptoms and accept that we need help. And that is okay. We are humans. We sometimes need help, and that's okay. It's great to connect with your support system, talk it out with your loved ones, family members, friends. And don't be afraid to ask for help, especially at the professional level, whether that's talking with your primary care provider, talking with your workplace if it is workplace-regarded stress, seeking out therapy or support groups. I wanted to highlight a few things to discuss with your PCP or your primary care provider during a visit. You should make sure to know what your blood pressure is and whether it is within range or not, and have a plan. Discuss your weight and BMI and what range it falls in. Having your yearly blood work done. Discussing your ASCVD risk score, which is your atherosclerotic cardiovascular disease score, which predicts if you're going to have a heart attack or a stroke or another atherosclerotic event in the next 10 years. It is a percentage. It's important for your primary care provider to listen to your heart and heart rhythm, and overall discuss lifestyle recommendations to promote good cardiac health. In the next few slides, I'd like to discuss a few studies regarding South Asian heart health. The first one is the Masala study. It's the mediators of atherosclerosis in South Asians living in America. It's the first longitudinal study of heart disease in the US based on South Asians. So it's a study that's been going on for many years. There are quite a few publications you can read about on masalastudy.org to gain more information on South Asian heart health. The next one I'd like to discuss is the Saheli study. It's the South Asian Heart Lifestyle Intervention Study. It was a research program using culturally appropriate interventions for South Asians to reduce the risk of cardiovascular disease. More info is provided at sahelistudy.org. And lastly, the SOUTH study, which is South Asians Active Together. It was a research program on how to improve physical activity amongst South Asian mothers and daughters. It was really nice to read the study and the benefits at southstudy.org. And all of these studies have public information and publications on their websites to read more about those studies. And lastly, I just wanted to say thank you for listening and chiming in. I'm Meghana Bachu, a family nurse practitioner at Washington Health, and as always, we are here for you.
Thank you. We do have a couple of questions. The first question is, in your previous slide, you mentioned probiotics. What are some good sources of probiotics?
So good sources of probiotics are usually in the dairy section. It would be milk, yogurt, kefir. If you are lactose intolerant, you can get probiotic supplements over the counter. Just make sure there's no extra, different bacteria in them. So one of the brands that I like is Culturel.
Okay, thank you. And our next question is, for those who do not exercise at all right now, what's your recommendation for them getting started? What kinds of things can they do?
That's a great question. For someone who has such a dormant lifestyle, I would just say trying to do those simple things in life is a good starting point. Instead of taking the elevator, use the stairs. Going on walks if you need to go somewhere close rather than using your car. Just small things like that will really create good habits to promote good cardiovascular health and lead to, those goals of moderate intensity exercise in the future.
This concludes our program. Thank you, Maggie, for this insightful presentation, and thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.